All right. I have a few slides that I'd like to share with you all, and in there we'll have variance process and face coverings as well, and whatever other questions we may have. From the first date of our COVID positive cases on March 9th, we've been working in a unified response and following the incident command system. As you are aware, Public Health and the Office of Emergency Management, along with other county employees, volunteers, temp employees, and municipal liaison, the City of Fort Collins has a liaison with us. We've worked together in this pandemic. It's a unified effort. You'll see that should be 1 through 5. I don't know why the numbers all come up 1 on this slide, but those first 4 are really those major objectives on how do we suppress the transmission of the virus within our community. And I'm not going to read them all, but definitely number 1 is very, very paramount, and that's identify and suppress the spread of COVID-19 through aggressive contact tracing, quarantine and isolation, active monitoring, increased testing capacity, enforcement, and strong public messaging. We're going to touch on some of our successes, and I'm going to give you a comparison from where we were back in March to where we are today, and it's rather striking. Well, we knew early on that our older adults were going to get probably hit hardest by COVID-19, the virus. And early on, we didn't know what else put individuals at higher risk for serious complication. Well, now we do, and we can look at these impacts on our residents in Larimer County. The data you see here is the most recent data that we get from the Colorado Department of Public Health and Environment, and they're the conditions most common when considered susceptibility for what they're called the very sudden acute respiratory syndrome from the virus, the SARS-CoV-2. However, when you're including other comorbidities such as underlying health conditions, obesity, or smoking status in Larimer County, this is probably around 30% of our population, or right around 100,000 people out of the 350,000 residents that are considered highly susceptible to that severe respiratory complications from the virus. So this population is highlighted in our suppression plan, and we'll talk more about that. It's important to know what the overall impact to Larimer County is. Now, here's some just amazing data here. When we look back in late March, our hospitals were starting to fill up with COVID-19 related patients. 1 week into the stay-at-home orders, we couldn't see the drop in cases yet. Today, we can see how well we did flatten the curve. When you go from March 31st, we had our ICU beds in use at 78%. When I say that, that was surge capacity. Most of the time, we have about 84 ICU beds in our 5 hospitals in Larimer County. They increased that to about 120, 125 by doubling up rooms, et cetera. So that 78% would have been well over our typical ICU bed capacity. That was based on the surge with our great hospital systems had put in place. Ventilators at that time were almost at 75% in use, and that's very concerning when this virus does get to that acute respiratory syndrome. Many people do need to be intubated and put on mechanical ventilators. And I know you've all heard Kevin Unger give some information on that as well. Back in March, we had 73 COVID-19 patients in our hospital. Today, May 26th, I'm excited to report that 40% on ICU beds, down from nearly 80, ventilators in use down to 44%. And here is just a fascinating, awesome number. We're down to 12 patients in the hospitals that are dealing with complications of COVID-19. Now, one of the challenges here is many of the people that do get admitted to the hospital, it's an 8 to 15-day stay in the hospital. So these individuals are in the hospital for a long haul. We are monitoring this information daily, and we're working with our hospitals. It's important to know we flattened the curve, but the curve doesn't go away. So we'll need to continue our efforts to continue to flatten that curve in additional phases as we continue through Safer at Home. Again, we receive daily updates from our hospitals, and we also track daily admissions and daily recovery or discharges of COVID as well. Early on, back in March, we knew to really do the good work, especially Objective 1, we were going to need many people, employees, community partners, and volunteers to really carry out testing, contact tracing, outbreak suppression, PPE, the communications, education and compliance. We'll talk more about that. We had 98 people working on that. As of today, we have 137 employees, community partners, and volunteers. activated in the response. Now, we're lucky and fortunate here in Larimer County to have many volunteers. One of them, the School of Public Health and Environmental Health at Colorado State University, has been very instrumental in helping us with this outbreak. So we really appreciate all the efforts we're getting from those 137 individuals. Early in the response, limited testing supplies and test kits limit our testing capacity in the county. You heard my frustration on a couple times, but we were one of the 3 counties given first responder and healthcare worker test kits in mid-April. And we continued to expand testing as supplies came in. In partnership with our hospital system, we can now get testing completed on symptomatic individuals within 24 hours of onset. Also, we are now providing testing to everyone symptomatic every Tuesday and Friday at Fort Collins on the CSU campus with a partnership with them. And we're looking at expanding to a site in Loveland, hopefully on a Thursday. So that's hopefully in the next couple of weeks. And I'm so pleased to announce that testing is now available for asymptomatic close contacts of identified cases by either of additional staff or signing up by providers or signing up at our test site. So we know that acute testing doesn't stop the spread of the virus. Rather, community-wide testing identifies who's carrying the virus and potentially spreading the virus. So testing is just a tool, an important tool in contact tracing to be successful, to suppress the spread of the disease. And many times I've met with you, I've said we did not have a denominator. I couldn't give you a percentage. Well, now we do. As of this is Friday, total tests conducted in Larimer County, 11,071. We have 613 positive for a 5%. I will say that's much lower than the state average at around 15%. So that number now we have, and it is 5%. Now, this slide tells you a lot more about how we've increased our testing capacity in the community. Back on March 31st, our daily testing was only at 20 countywide. We could only test 20 people. And that day we tested 18 with a positivity rate of 33%. Look at us as of Friday, May 23rd, with the awesome efforts of UC Health, Banner Health, Salud, Estes Park Health, many, many other providers in the community. We're up to 1,000 tests daily we can do from 20 just a couple months ago. And on Friday, we tested 359 people with a positivity rate of 5%. So this, again, is COVID PCR acute tests. But this is so important when we're doing much of our work that we're able to have that testing capacity. We have done that. And I'm just so proud of our community and all of our partners. To go from 20 to 1,000 is just rather remarkable. Hats off to everyone. Now, why is this so important, this testing business? Why it's only a snapshot, I've heard from some people. Well, it's a lot more than that. For us to first go into safer at home phase, we had to modify our case investigation and contact tracing process. The staffing level was increased. You saw we increased the staffing by 38 people. Most of them went to this group right here, the disease surveillance and infection control, or case investigation and contact tracing, because we needed to be able to have the staffing to deal with every positive case. So what's happening is most confirmed COVID-19 cases are put into the statewide surveillance system within 24 to 48 hours of being tested. The case investigation team assigns an interview and contacts the case for an interview within 6 hours of the case appearing in the system. So all close contacts of cases are identified during that initial interview and are contacted to provide information on quarantine. So when you look at back where we were on March 31st, it was taking us about 7 days to get a test result back. That's halfway through, the 14 days we're even looking at for COVID-19. So our isolation orders were lagging about 7 to 8 days, and then quarantine orders were 9 to 10. People were out in the community potentially spreading the virus. That was not working. Well, as you look today, and at least the last 2 or 3 weeks, we've been getting test results within 24 hours. So we're able to do isolation orders within 24 hours of contacting the individual. And then our quarantine orders are 48 hours. So isolation, 24, quarantine, 48 hours versus 7 to 10 days. So we are able to get those that are sick or those that are potentially sick at home, where those that aren't out in the workforce or out getting our activities needed within the community. That's been very, very key in our suppression. That's how we are really being able to suppress the virus and the transmission of the virus is based upon this testing and contact tracing by many, many people doing some fantastic work. I will also point out that there are occasions where somebody will refuse an interview. We have good folks on there that are working with behavioral health specialists to help provide support to the individuals to talk them through. You might be a language barrier. We're working through that because we want everybody to understand what the situation is and where they're at. One of the other challenges was, 3-4 weeks ago, was quarantine. Individuals that had close contact to somebody that was positive. We just told them go home for 14 days. Well, that's very, very difficult, even at stay at home or safer at home. Well, now we can give them the option to test. So they may be asymptomatic. They can come to one of our testing sites or go through their provider at no cost and get tested. So that has been key too, because those that are positive, they will go home. They know they're positive, or they'll seek medical care. But if they're not positive, then they can potentially get back out in the community and get back to work. So that's been really, really key. Another big aspect to our response is our outbreak suppression. And Larimer County had the state's first outbreak in a long-term care facility, and we immediately formed an outbreak task force. Now, this team's been reorganized, and we've gotten the right people and mix in there, but there's a team of 8 public health investigators and epidemiologists that have an important job of ensuring an outbreak facility is following strict guidance to suppress or contain the spread of COVID-19 within and outside of the outbreak facility. So this task force is assigned to all correctional facilities and long-term care facilities, as well as many businesses where a cluster of cases are identified. The task force always has been working with our child care facilities and schools, and they work very closely with our contact tracing team and testing team to bring COVID-19 sampling off-site and the ability to train partners on how to do COVID-19 sampling at their location. And another key aspect of this group is about 2 weeks ago, we became more proactive. So now when we get just even one case positive, we are able to contact that employer and begin working through some of the suppression activities and make sure they're following the checklist. Once we get a cluster, then we need to either look at closing the facility for cleaning, testing all the employees. There's different parameters we do, and we look at. But what that's helping us is keeping it to one little cluster or a hot spot that we put out versus community-wide spread again, like was going on in March. So this team's really important. Now you see, we had 1 facility back in March, 7 today. Again, that's because we're being much more proactive and working with the business owners, operators, managers right off the bat to suppress the spread within their establishment. Communications and public information management is always vital in any kind of emergency, and the communication struggles with a rapidly changing pandemic like this is that information and messaging adjusts consistently as we learn more from other countries and states, and we continue daily. Face covering guidance is a great example of this. Initially, CDC and the U.S. Surgeon General said masks didn't provide protection. But then on April 4th, they encouraged everyone to wear masks due to the high asymptomatic spread of COVID-19. And now we've got many good articles published, peer-reviewed even now, or being reviewed, that demonstrate the good suppression work that the masks provide on the respiratory droplets. We can certainly talk more about that, and absolutely prepared to. But you'll see the public information management before March 31st, 960 calls. That's not including the several thousand text messages and emails and social media requests. And then between April 1st to May 26th, nearly 2,000 calls that our staff have been building. And I know the city has similar numbers as well as when you get calls in from our residents and businesses. Another part to our suppression plan is PPE, and that was one of the biggest supply chain struggles early on in the response. And it should have been readily available, and it wasn't. And our hospital systems, nursing homes, and long-term care facilities needed it to suppress the spread of the virus within their own establishment. So we continue to push and order through every supply chain we could. Our persistence resulted in being one of the first counties to receive PPE for our community. And as you can see, back on March 31st, 110 deliveries were made to our external partners for PPE, and then as of today, 240. Now, if you look at the next slide, I think this is more telling. We have distributed nearly 71,000 N95 masks, procedural masks, 168,000, face shields, 2,500, 1,700 boxes of gloves, and 3,000 isolation gowns. That's just a tribute to our logistics team and everybody that's involved in that. But that has really, really helped our medical systems, as well as our long-term care, our skilled nursing facilities, have the right and proper PPE to protect themselves, as well as their patients and clients. One of the key components to our suppression plan is ensuring education and compliance. And early on, we did establish a compliance and education task force. And you see back on March 31st, we had 4 individuals. Those were we had environmental health specialists. Those are the people out inspecting your restaurants, typically. But we knew we needed more help when lots of questions coming in. So we've been able to add some of the county code enforcement individuals and county planning staff. So they make now up of a team of 10 that are activated to help with that compliance and education task force. As you can imagine, when we get to the variants, they've been really, really busy answering lots of calls and fielding lots of questions regarding the checklist. And what we're learning is our businesses want to do it the right way. They have lots of great questions. And so we've got a team there ready to help assist them and guide them through the process. You know, the alternate care site, that's an important piece and one of our requirements in our suppression plan. And you know, you're back on March 31st, we were still exploring local options for maybe a small potential alternative care site. Well, today we have the alternate care facility, which is now completed, at least the first 200 beds, and it can expand up to 600 to 800. UC Health, thank you, is agreed to jump on and be the medical oversight. So at any point we need to use the alternate care site, it is ready to go. Now, this will help less acute COVID-19 patients. Those that are in ICU or need to be intubated, they will still be in the hospitals. But those individuals that don't need that level of care will then have an option for a bed. It's very set up nice. You can see on the left, they turned our fairgrounds into a hospital, and it'll be ready to go if we need that, and especially in the late fall when you maybe have heard the potential for a second surge. So that alternate care site is a real jewel within our community, at least for our suppression plan moving forward. So what are we learning? You know, we're learning a lot. One thing I can tell you, unified response and following incident command is working. We wouldn't have been able to flatten the curve without a unified effort. Our hospital partnerships have proven to be paramount to our success. We keep in regular contact with Margot, Kevin, and others to get daily updates, and they help us make decisions for our community. Not every county has this, and we are grateful we made these connections before a worldwide pandemic occurred. Our hospital systems, including UC Health, Banner Health, and Estes Park Health, and others, have been amazing partners in this, and just fantastic, especially around the testing part of it and saving lives. When you look at our mortality, a soul is a soul, and I take that very seriously, but you look at other counties and the loss of life, they have done a great job of learning how to respond to this virus and save lives. And they were trying new things and seeing success in a time when there is really no evidence, minimal data, just trial and error. Our hospital has done a great job helping these patients pull through and save lives. And it was that flattening of the curve that bought us the time for our hospital systems to really learn by that trial and error. Our swift response and actions on nursing home, long-term care facilities, outbreaks, boy, they've been fantastic, saving lives there as well. That's some tough work. As you can imagine, the people in there are scared, they're concerned, and they've done a really good job in these facilities to save and help people. It's been very, very remarkable. Asymptomatic spread is a big shift in this response early on, and it means we have to protect each other in ways we've never expected. And it's hard to message that when there's fear and anxiety, and both of those are high. What else we are learning? Well, we knew it. Larimer County residents are following the restrictions. They're sacrificing together. We bent the curve, and we bent it extremely well. Unfortunately, that curve doesn't go away, but we can move into the next phase safely, and I think that's exciting. So what's next? We chose to move into the safer at home phase while many other counties stayed at the stay at home phase. We believed we were working towards a good suppression plan. We were seeing our hospital numbers decreasing, so we stayed with the safer at home. But then as 2-3 weeks ago, our numbers continued to improve. We had our suppression plan written and approved by our hospitals. We had our early warning indicators plan conducted, approved, and ready to go. So the next phase for us was we applied for a variance on May 17th to the Colorado Department of Public Health and Environment, and we're granted mostly approval on the 23rd. And we want to continue to reopen our businesses safely and thoughtfully, and we will unless one of our triggers is hit on our early warning indicators. So speaking of the variance, and that came in on Saturday, approvals for all of our 12 areas were granted except for a couple, and I'll go through that. Outdoor group recreation was not approved. Day camps, bars, which at the time breweries, distilleries, and wineries are put into that same category as bars. Childcare and long-term care. We have learned that since yesterday, day camp guidance did come out, so we're working through the guidance on those day camps, and we will need to submit they'll need to submit plans to us to be allowed to reopen June 1st. Residential camps are closed through June. New restaurant guidance was released Monday, and we're working to align our requirements with the state guidance. But dine-in restaurants is open up to 50% capacity, still maintaining strict social distancing. People that come in to eat, absolutely, you can't eat with the face covering. So our restaurants are taking higher precaution. Our servers, our bartenders, our greeters, our managers, our hospitality people, they all are in face coverings. They're up and they're sanitizing and cleaning. So there's steps they're doing to protect not only their customers, but their own employees. And that 50% allows for the good social distancing. And we talked a little bit about outdoor seating, and we can, if we have outdoor seating, they can get up to 60%. So we were excited about being able to increase that as well. After being told no to breweries and tap rooms on Saturday, the new restaurant guidance that was released Monday changed that. And what it says, they did agree to allow breweries, distilleries, wineries, and tap rooms to open with this restaurant phase as long as they, quote unquote, serve food on site. That can be a partnership with a local food truck. It does not mean they have to have a kitchen. They need to follow the restaurant checklist on our website, and that was strictly from the governor's office. So breweries, distilleries, and tap rooms that can meet that by serving food on site, they are able to open up, and they're able to follow the restaurant guidance checklist that's on our website. Bars, strictly by the bar definition, they remain closed at this time. You can find all our guidance checklists and restrictions on our website at larimer.org/variance. I have to say, we need to continue to be diligent on our face coverings, social distancing, hand washing, and frequent cleaning to help slow the spread of the virus in the community. We do not want to see a surge in cases that may require us to roll back partial or many of the reopening steps we're doing. So it's important for our community to know, and this is from the bottom of my heart, we've done everything possible to go from 72 positive COVID patients in the hospital on a day-to-day basis, that's what we were seeing, down to 12. To see testing results at 5%, to be able to get testing up to 1,000, our contact tracers being able to issue these orders within 24 to 48 hours. This has worked, and it's working well. And one of the tools is face coverings. They're working. And we got to continue these efforts, because if we all of a sudden get 20, 40, 60 people in the hospital, our trigger is 65. We're going to have to start rolling back. Or if any of our test results go over 10%, 3 days over a 14-day period. So these are our early warning indicators that we're looking at daily, and we're working with county IT to build a dashboard on our website that will show these indicators, and it will give us status where maybe it'll be color coded, or it'll have some indicator on where we're at. Right now, we're doing really well, but as you've heard from the hospital systems, it only takes 2.5 days of community-wide spread, and we're back to where we were March 31st, and nobody wants to go there. So I think it's really important to know things are really going well in Larimer County, but we're going to have to continue making some of these sacrifices to continue to keep open in our businesses. And also gyms and theaters, we were excited that they are part of variance requests. So they are opening at limited capacity. As you can imagine, a gym's a little more difficult than some of the other activities, but they are open, and we're excited about that. We're also looking at outdoor recreation and some of our Little League and our youth sports. So those things are available are per plan, and we're excited. Our graduation ceremonies is now a local control, so our school districts can submit those requests to us to review, and if they meet the checklist, we can have graduation ceremonies. So we're excited about that. Lastly, we expect another round of guidance and changes just before June 1st, as that is the date the governor has mentioned he will be reevaluating where he's at.